Hello again. Welcome and thank you for joining us today. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'll be your moderator for today's Faculty and Research Town Hall. Once again, we have brought together a group of panelists to provide updates on the continuing evolution of our operations during the COVID-19 pandemic and to answer your questions. As we are all aware, the pandemic continues to provide new and unexpected challenges for us. These town halls play an essential role in keeping us united as a community during these times. Some questions were submitted during registration. However, please feel free to use the Q&A window to submit additional questions for our panelists today. Due to our time limitations, we will not be able to get to all of your questions, but we will log the questions as they come in and post answers on the Return to Learn website. And the link is being pasted into the chat right now. Today's webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that has been pasted into the chat. Now I'd like to proceed by introducing our co-host for today's town hall, our Executive Vice Chancellor for Academic Affairs, Elizabeth Simmons, for some welcoming remarks. EVC Simmons.
Thanks very much, SAVC Continetti. It's great to see everybody, to know that you're all here and joining us today. And we have some good news to start with. You'll see from our medical experts that the local health data and national health data are encouraging at this time. And our local sense of, I would say, of what's going on the campus is also encouraging. As I've been talking to people around campus, I hear a sense of excitement rebounding, people talking about research plans, artistic performances, teaching innovations, things that they're able to get back to and engage in. And there's a sense of relief at returning to a situation that's feeling perhaps more familiar, less disrupted. At the same time, we do, of course, remember that the times before the pandemic weren't perfect, and in fact, weren't equally good or didn't offer equal opportunity to all members of our community. The pandemic situation threw some of these inequities into really stark relief for us, and we've been trying to use equity-centered leadership principles to address the pandemic and to think about how to move forward. And as we are going forward as a university to build what our new equilibrium is going to be, whatever that will evolve to be, I hope that we can carry the spirit of Black History Month with us and to keep building an ever more inclusive UC San Diego that we can be ever more proud to be a part of. So thank you for joining us today, and thank you for joining us in this journey to keep improving the university over time. Back to you, Bob.
Thank you, EVC Simmons. Now I would like to introduce our second co-host for today's meeting, Vice Chancellor for Research, Corinne Peek-Asa, for welcoming remarks. Vice Chancellor.
Thank you. I'm delighted to be here also to welcome everyone. I'm relatively new to the campus, so I haven't had the opportunity to meet anyone really outside of these town hall meetings. So to me, they are a very nice way to just have some togetherness with the campus community. I think we, again, as EVC Simmons said, we'll hear some good news that we're moving towards being able to spend more time together, and we will continue to provide guidance and best practices and exactly how to do that. And then later on today, we'll be able to spend a little time with a research update, taking a little break from COVID news. So I look forward to that and to continuing to answer questions. Thank you.
Thank you, Vice Chancellor Peek-Asa. I'd now like to introduce our first presenter for today, Professor of Medicine, Dr. Chip Schooley, to give us an update on the continuing evolution of the pandemic. Dr. Schooley.
Thanks very much, Dr. Continetti, and I want to say I'm pleased to be able to share some good news, as EVC Simmons mentioned earlier, to talk about how we're finally beginning to see the Omicron wave pass behind us. As you've seen for the last couple of weeks, things in the US have been getting gradually better. We're now down to a point that we were in terms of new cases, just as the Omicron variant was arriving at the beginning of December. The same thing is true for California. You can see that California itself has actually also had a dramatic fall in Omicron cases. If you look in the middle gray graphic on the bottom, you can see that the hospitalization rates in the US have also finally begun to fall. It takes a little bit longer for them to fall than the case rates, but we're now beginning to see the hospitals clearing out a bit and being able to get back to doing other things. In San Diego, things are also quite good. We had a big explosion of cases in early to mid-January, but things have been progressively getting better since then. We're now down back to close to our baseline levels. Hospitalization rates in San Diego County and at UC San Diego Health are also down substantially. We're now down to about a third of where we were at the peak. On the campus, things are also quite good. If you can see the yellow lines in the midst of the green histograms, those yellow lines reflect the campus positivity rates for people who are testing. You can see that with our students, we're down at 1 to 2%, our employees around 2 to 3%, which both of which are really quite acceptable levels as the Omicron surge fades. In terms of new cases, in the middle panel, you can see the student cases are running these days at 7 to 10 a day. About 60% of them are off-campus residing students, about 40% on campus on average. And on the right panel, you can see that activity among the employees is really much better than it has been for a long time, with 1 to 3 or 4 cases a day, down from 30 or 40 cases a day that we were experiencing in early January. Looking forward at using Point Loma as our lens to look forward, you can see that in the blue lines, the levels of viral RNA and wastewater at Point Loma that reflects the entire San Diego community are dropping very rapidly. The wastewater levels drop more slowly than the actual case numbers because people who have recovered from disease continue to shed some RNA in their stools for a few days. But the bottom line is we're seeing this, which has been one of our important predictors in the past, looking good as well. The residual virus we have is primarily the Omicron variant that arrived here just at the end of November, about the time it was discovered in South Africa. It rapidly displaced the Delta variant in San Diego, so that about 95% of the cases in San Diego and indeed on campus are the Omicron variant. I just want to make one comment about a new strain you've been hearing about, BA2, which has been called the stealth Omicron variant. It is related to the Omicron variant, but it's a bit different. It's so far been primarily found in the old world, as we used to say, but has also begun to appear in North America with a few cases in the US and Canada. We have some in San Diego. It's been seen in the wastewater and also a few cases sequenced on campus. This shows you what has happened in a number of locations as this variant has come on board. The orange lines are the Delta variant. The light green lines show what happened when Omicron came. And if you just focus, for example, on South Africa, the top panel, second from left, you can see that when Omicron arrived, Delta was pushed down. You can see over on the right side of that same graphic, you can see a darker green line coming up. That's the BA2 variant. And that's what we've seen around the world as BA2 has begun to spread. It has been able to spread because it is transmitted more rapidly than the Omicron variant. But from what we've seen of its morbidity and mortality, it is really Omicron-like, certainly no worse. And we don't anticipate that it will be as rapidly spreading as Omicron because of the increased level of protection from the Omicron surge and from vaccination that has occurred since then. So let me stop here, and I'm going to skip the next slide in the interest of time and turn this back over to ABC Continetti. And to actually apologize to Angela Socha, who'll talk to you about boosters.
Yes, thanks. And so while things are really good, we're in a pretty stable position right now. We're going to stay with many of the safety measures that we've had in place for the last few weeks. One of the core things is boosting. And we do have a gap. We don't have the 95 to 97% rate of boosting, which we had with our primary vaccination. So this is an important area for us to focus on and try and encourage our colleagues to get boosters when they're eligible. And that is based on what your primary vaccination was. With the Pfizer Moderna, it's a 5 months, J&J, 2 months, and then some of the WHO, again, 5 months, and they may benefit from a second dose of a messenger RNA vaccine as well. There is some talk about whether there should be extra doses. The groups that may actually fall in that category could become the immunocompromised. They have less of a time frame, and they may be eligible for 4th doses as well. Children, we have 5 to 12. Unfortunately, we still don't have that group under 5, but the 5 to 12-year-olds can get vaccinated, and if they are out, I don't think any of them yet are eligible for boosters, could have this at health system sites. Price Center does not do pediatric care, so for your children, please use the health system sites. We're also recommending that individuals who've had a recent COVID infection do not immediately get a booster, delayed to 30 to 60 days. And there is some discussion whether actually having an infection could be comparable to a booster. So this dialogue could change over the next few weeks. So in case we are thinking about it and monitoring it right now, we are encouraging folks to take advantage of a booster, but to recover from their COVID infection for a while. Since they've basically gotten a bump in their immunity through the infection, there's no need to get the booster right away. Okay, and the new term is kind of moving from fully vaccinated to a phrase of up to date in anticipation that we may face more than one booster in the course of this virus being with us, that this may become a semi-annual, annual process to get a periodic shot, just like the flu vaccine. So once you've gotten your booster, it's about 7 days before you get the full immunity benefit. So just be careful in that 7 days, you're not yet up to date. And you're also up to date if you're not yet eligible. Remember, if you just finished your primary series in December, you're not eligible for a booster yet. So the not up to date or not fully vaccinated community are those who just got their booster a couple days ago. Those that are eligible and yet have not gotten a booster. So they have passed that crossing of 5 months for Moderna or Pfizer or 2 months for Johnson & Johnson. So they're eligible, but they have not boosted. They are not considered up to date. Or if you didn't complete your initial 2-dose series, or you have an exemption and you're not vaccinated at all. So in that group, those are individuals we consider not fully vaccinated and not up to date. And they have special requirements for their own safety. And we're going to talk about that with the testing. And also they have different requirements for isolation and quarantine. So it's important to know which status you yourself fall into. Okay, the mandate. Boosting is covered under the mandate. The deadline for compliance is March the 1st. Once you become eligible for a booster, you have 15 days as a healthcare worker to get that dose. As a campus employer or student, you have 30 days. If you've had a recent infection, we've already extended your time and we know about that infection in your health maintenance record. As an employee, that's your My Chart. As a student, it's your My Student Chart. We have extended your eligibility and pushed it out by 90 days if you've had a recent infection. If you already have a religious exemption for primary vaccination, that exemption will cover boosters. So March the 1st is just around the corner. So again, please be aware of your personal status. And if you are due for a booster, please take advantage of it. There are plenty of appointments available at the Price Center, as well as all the health system sites. So there's no reason, access is not a problem for not being boosted. Okay, testing. The asymptomatic or surveillance testing. This is for individuals. The only indication is asymptomatic testing. This under campus current policy is for all of the unvaccinated or not fully vaccinated, not up-to-date individuals. Those individuals need to test twice a week if they're coming onto campus. So important that you continue with twice weekly testing. Symptomatic testing, when you have the new onset of symptoms, everyone should take advantage of testing, regardless of vaccination. The only exception is if you've had a recent infection with COVID-19. In that case, if you've been fully recovered and you start to have new symptoms, please speak with your provider. Occasionally, someone does get a reinfection earlier, and we will recommend testing. But as a rule, we don't recommend testing in the first 90 days after infection. Keep in mind, if you have new symptoms and you've recovered from COVID-19, you could have acquired a different infection. So anytime you have respiratory symptoms, please wear a mask to take advantage of protecting others and avoiding spread for something that could be a different kind of viral infection. It's not necessarily COVID-19. Wastewater. Wastewater is a great signal because we start to see it before we're even aware. You saw of infections floating around in campus. We saw this in the Point Loma. So signals in the buildings, whether they're residential buildings or the buildings we work in, do indicate someone is shedding virus into the sewage system. And we recommend individuals in those buildings get tested, regardless of their vaccination status, with the one exception being someone who's recently recovered from COVID-19. Then we would not have you test in that setting. Exposure testing. If you've been known to be exposed to an individual with COVID-19, we recommend you test right away. We know that Omicron can move fairly quickly and the BA.2 is even quicker. So if you've been notified that you were around someone who had COVID-19, and certainly if you were not masked, but it's always good, even if you are masked, you'll be on the safer side and then test 5 days later, regardless of vaccination status. And remind everybody that the vending machines are fully operational. Use your campus ID to swipe. You can get a test right there. Please drop them off in the pickup bins before 2 p.m. That's when the last pickup occurs. And generally the results are coming out that evening. We're seeing a bolus of results in about 6:30 at night and another bolus at 9:30. So if you get your test into one of our vending machine pickup bins by 2 o'clock, you're generally going to get your result back that night. Masking, we've moved to KN95s as well as N95s, a little better protection because of the high transmissibility of Omicron as well as the BA.2 variant. If you don't have a KN95 or an N95, then if you're going to use a surgical mask, we recommend you do a second layer with a cloth covering. Where do you need to mask? We are continuing to mask in all indoor spaces. That means the classrooms, research labs, our other built working spaces. The only exception is if you are alone in an enclosed office. If you're having meetings, and we are allowing people to have indoor meetings, we've moved from January, it was only critical in-person meetings. Now we're saying go ahead and have indoor meetings, but no food or drink. Our students are in phase 2, which means within their residential units, they are not wearing masks. They are not visiting between units. We encourage them not to visit between units. And whenever they're outside of their unit, they are masking and following other campus requirements, which includes like the elevators, the lounges, et cetera. So masking in all of those places, but not in their units, which makes their life a lot easier. Okay, isolation. CDPH, CDC, it still requires 10 days of isolation with an exception. If you have lost no fever, so you're not taking Tylenol, you're not suppressing a fever, you have no fever, and your symptoms are pretty much gone or very much resolved, and you have a negative rapid antigen test after day 5, then you can leave the isolation where you've been, whether that's your home or if you're a student in one of our isolation hotel spaces. But you do need to mask around others for a full 10-day period. So if your antigen test is positive, then you complete the 10 days. You don't need a negative test at the end of 10 days. So the test is only to shorten that period in which you must stay isolated to one room. Okay, so I think that's important. You don't need a negative test after 10 days. And we know people still shed virus, which is why we don't test for that 90-day window. And the last thing I want to cover is quarantine. And it's a little different, whether you're fully vaccinated or if you're not. If you're up to date in your vaccination, then you do not need to stay put. You are allowed to move about, but you must stay masked for a period of 10 days. You should still test when you first find out and test after day 5 in the chance that you've converted, but you're allowed to move around campus. For others, if you are not fully vaccinated or you're unvaccinated, not up to date with you, in other words, you're eligible for a booster and you haven't had it, you do need to quarantine for 10 days at home. In other words, not come onto campus. You also need to test, as we talked about on notification day 5. If your day 5 test is negative and you have no symptoms, you can end the quarantine, but you can move about, but you still need to mask for 10 days. And again, that moving about restriction in the first period only applies to the unvaccinated or not fully vaccinated community. Those that are fully vaccinated are not required to quarantine and stay out of circulation, but you do want to test, and everybody needs to mask. All right, that's the summary, and I'll be taking questions throughout the chat and later on.
Thank you, Dr. Sosha. So now I would like to move on and introduce Dr. Ebony Williams, Director of Virtual Experience and Peer Engagement Initiatives. Dr. Williams will tell us about spring break programs and activities. Dr. Williams.
Thank you, SAVC Continetti. It's great to be here with you. I am here on behalf of the Vice Chancellor of Student Affairs and all our partners to put together a spring break for our students. Welcome to week 8. And as you know, when we get to week 8, we are looking at close to the end of the quarter, and being in the beautiful sunny city of San Diego, we want to provide opportunities for our students to engage and interact in our city, but also have an opportunity to learn and grow. And of course, if we're hosting it, we know there's some level of safety affiliated with it. We picked 4 categories this year. So you have health and well-being, you have research, you have leadership, and you have service. I'll start today by talking about health and well-being. If you have not played or looked at what we're doing with recreations at UCSD, please engage. There's things that you can do as a faculty member or an administrator or staff member. But for our students over spring break, we will be doing zip lining, roller skating, surfing, yoga, underwater basket weaving, and then there's some aerial skills, all of which were really popular, and they're all over throughout the week and throughout different locations in San Diego. And most of those events, all of those events will be in person. The next 2 groups are research. I know we're here with Faculty and Research Symposium, so we appreciate the idea of exposing our students when they're not in classes to an opportunity with research. So we'll be hosting a virtual opportunity to learn about research that's going on, and a discussion that some Black undergraduates put together through using our Crash Conference, which was one of our first all remote conferences when we went to COVID. That'll be on Tuesday of that week in the middle of the day. And then there's opportunity to meet a mentor. Why is mentoring so important to you in your research experience and in your professional journey? That will be an in-person event with the opportunity to grab food. So we're really excited about that. Our next category is leadership. Leadership is going to happen on Monday and Wednesday of spring break. That will be a fully remote opportunity and will allow for students to have it permanently a part of their transcripts as connected to our co-curricular record. And our last subject is not something that we take lightly. Some of our students, a lot of our students, most of our students at UCSD gave of their time to their communities as a part of being eligible and being excited to be a part of our community. And they continue to give while they're here. We've earned records based on the service that our students do here. So we're excited to offer 2 opportunities here locally in San Diego on Monday and Tuesday for our students to give back. We appreciate the partners that have helped us put these opportunities together. We look forward to continuing to partner with even you in providing research opportunities and other opportunities that will grow our students when they're not just in class and when they may be looking for something to engage around. And we encourage you to promote this to your students and let us know if there's anything else you'd like to see us doing. Thank you for having us here.
Thank you, Dr. Williams. It's exciting to hear about some more in-person activities for this spring break. Now we're going to move on and hear about spring and summer instruction updates and summer programming from Associate Vice Chancellor for Educational Innovation, Carlos Jensen, and Director of Summer Programs, Rocco Fragomeni. Vice Chancellor Jensen.
Thank you, Dr. Continetti. So just giving a brief update on where we are with classes. As Dr. Williams said earlier, we're in week 8. So just a quick reminder to everybody that indoor masking is still required at UC San Diego, and to please follow those precautions. And then another reminder to our instructors and our faculty to please be flexible where needed, and that flexibility, not putting students in a situation where they feel the need to take unnecessary risks, is really key to the safety of all of us during this pandemic. As we look to spring, we have the schedule out. Students are signing up for classes. About 6% of sections will be offered remotely, barring any unforeseen changes. spring term will be, we'll have our outdoor classrooms fully available, and faculty can request those through the registrar's office as usual. At the end of the term, after commencement, we will take the outdoor classrooms down. They need to be inspected. They've been up for almost 2 years. And our plan is to redeploy them if the situation warrants it, but maybe take a break depending on where we are. For summer classes, Senate has granted a special dispensation again for this summer, meaning that we can offer remote classes over the summer. And I know that many programs are planning to offer robust offerings. Reminder to everybody, we had a 50% increase in summer enrollments over the last 2 years. Some of that attributed to the increased access that remote offerings provide. And we're expecting to see other summer programs and summer success programs move forward, including the largest summer bridge class ever for UC San Diego. So we're very excited about that. In addition to just summer courses, we are expecting to see a substantial return to other summer programming, including camps, both for our own students, for minors, pathway programs, things like that. Obviously subject to what the conditions are during summer. So in summer programs like Cosmos and Enlace, Summer Bridge, SEI, Path, etc., are expected to return with some additional safeguards. And HDH has let us know that they are hosting conferences, seminars, and other events during the summer. I know that that's been an eagerly anticipated thing for our campus to see the return of those. So please get in touch with HDH at the email meetings@ucsandiego.edu. And then finally, we are doing the best that we can to coordinate and plan for this summer, but letting you all know that we have a new director for summer planning, Rocco Fragomeni, who will help us start early on planning for summer 23. So Rocco, do you want to say a few words?
Yeah, thank you, Carlos. I just want to say I'm very excited to be a part of the campus and very much looking forward to continuing working with those of you that I have had the opportunity to already connect with about summer 2022. But we are hard at work for summer 2023 and looking forward to providing everyone holistic and streamlined guidance and support for their programs going forward into the next year. So thank you for those that I've been able to meet and looking forward to meeting the rest of you. Please feel free to reach out if you have any questions or would like to get more information on how to start new or continue your programs that you're already working on. Thank you.
All right.
All right. Well, thank you, ABC Jensen, and welcome to you, Director Fragomeni. Now we're going to hear from Danielle Schulte, Employee Relations Specialist Supervisor, to give a few updates from Human Resources.
Good afternoon, everyone. I just want to go over a few points. New employees have 2 weeks from the start date to provide documentation of being up to date, which means fully vaccinated plus the booster. And it's important that you make sure your vaccine and booster information is documented with the UC San Diego system. If for some reason you are not eligible for the booster just yet, you have 30 days from your eligibility to get boosted. Of course, if you have had COVID within the last 90 days, you obtain an automatic temporary medical exemption for 90 days post PCR test before you need to show any compliance with being up to date. Also, I want to remind you that it's important as we've continued to be coming back to campus and as things are progressing, I think it's important that we all check our flexible work agreements to see if maybe they need to be updated, changed. Maybe we need to start looking at more flexibility. Maybe looking at work schedules to be considered to meet off-hour needs. So I would recommend that you look on Blink to look at our flexible work arrangements and also check how things are working and be sure to update your remote work agreements. as Dr. Socha has stated, the University of California will, at San Diego, will remain requiring the mask mandate for everyone, regardless of vaccine status or exemption status. We are guided by the national, state, local, and our campus experts as far as why we need to continue to do this. It's based on the best practices about epidemiology, medicine, the predictive model, and public health. I know some people don't like it. However, this is for the benefit of everyone. And finally, this is something that Terry Winbush, who normally would be presenting, has really made it a point to remind everyone here on campus is that we need to take care of ourselves and show grace to others. This has been a tough couple years. We are we're not quite out of it yet, and there are continuing to be other things happening just as things start to slow down. As far as COVID, we get a new variant. Things start getting exciting, to put it euphemistically, in the world. So we need to be kind to ourselves. We need to be able to take care of ourselves. And you need to take care of the people who you supervise. Be more sympathetic to delays. There may be delays, and we need to give people grace for that. We need to be willing and able to provide adjustments for people's schedules, and whether it's to our subordinates or to ourselves. And that's it. Thank you very much.
Thank you for those that update and those very important reminder there, Danielle. Now I'd like to pass the mic over to Vice Chancellor for Research, Corinne Peek-Asa, who will lead us through the research updates portion of our town hall.
Yeah, thank you, Bob. We're going to take just a little break from COVID and talk about some research updates, which includes some really good news, which is that we've just been working on the new data from the Herd Report, which tracks research expenditures. We're closing out fiscal year 20, and UC San Diego remains number 6 of all national universities in research expenditures. So we are number 7 in federal expenditures, 9 in industry, 11 in nonprofit and institutional. And the way we reach an average is that we rank highly in all 4 of these categories, whereas few other universities really hit all those marks. We are number 4 in looking at only public universities. We are seeing research growth, and that's a very remarkable thing in such a difficult circumstance. We have seen a lot of growth in COVID-specific research, which of course we had coronavirus research before the COVID outbreak, but not nearly to the extent that we do now, which makes sense. And some of the people leading that research that is getting national, international attention are on our panel today. So I want to thank them for those efforts. We have research that ranges from $1,000 of a grant or contract all the way up to hundreds of millions of dollars. And even though the rankings are really nice, what really matters is the impact that research has. And so it really is not so much the size of the award, but what we're studying, how we're advancing knowledge, who we work with, and the discoveries, the creativity that goes into the research that we do. So I just want to give us a great pat on the back and a champagne toast for what we're contributing to solving some really, really thorny problems, including how to handle and learn and creating a learning system in such things as a pandemic. So I do want to take 1 second on the next slide to briefly address an initiative that we have been working on with our Office of Contracts and Grants. So every time any of you involved in research bring money into the university, it has to have a proposal that goes through the central office. And what we are seeing that is a very big stress on our staff is that we don't get a lot of time to review those. And so we're trying to initiate a 14-5-2 proposed timeline that 14 days ahead of the due date, you initiate the routing form, not complete it, but then we do complete it 5 days in advance. So there's adequate time to do a full review. There's a great deal of both institutional risk as well as individual researcher and research team risk when there's no review to these things. Sometimes we can find really simple little issues that might take your proposal out of contention that we can fix in a matter of a couple of hours. So what we're really hoping is you can help us increase the amount of time that our staff has to review proposals as they come in. I am also very excited now to turn to Dr. Camille Nebeker, who is our new director of our research ethics program. She is a professor in the School of Public Health. And the reason, not just because it's so great to bring her on board, but in looking at the COVID outbreak, but also many of the other issues related to social justice, to compliance, to equity. We are very happy to bring Dr. Nebeker into our team to help us advance research ethics. Her research aligns along this area, so it's a really nice mesh of all of her effort. And she is having a little bit of internet instability, so won't be on visual, but we will be able to hear her. So Dr. Nebeker, I turn it over to you.
Thank you, Vice Chancellor Peek-Asa. And I'm just thrilled to be joining the Research Ethics Program as the director. I've been involved with the Research Ethics Program since I arrived at UC San Diego in 2013, and I'm working closely with Mary Devereaux, who has also been involved with the program for probably closer to 15 years, and Star Culver, who's the program manager and is a recent hire to the Research Ethics Program. And we are now going to be located in the Qualcomm Institute, which is Atkinson Hall, more central to the campus, and really want to engage with a lot of our campus community. So the things that the Research Ethics Program has been known for, and our reputation is international, that we are really leading the work in creating very innovative research ethics education. Mike Hallichman had developed this program initially, but really thinking carefully about the teaching learning model of how do we educate our students and our faculty and trainees about ethical and responsible research practices. So we have a really solid foundation in education. We also do quite a bit of consultation to different stakeholders on campus. And sometimes those are consultations where people are having some challenges. We help sort through those. One of the areas that we're really going to be developing as we move forward is just to work more on our collaborations across campus and how do we engage our campus stakeholders and really thinking about what our roles and responsibilities are for affecting change in our research ecosystem. As we do that, I'm going to be working with faculty who are writing grant proposals to start thinking about how we can embed secondary and exploratory aims into the funded research that we do that can inform empirically what makes for a best practice in research ethics. One of the things that I do when I teach research ethics and the scientific ethics course that we have on campus is I use the behavioral ecological model to help our students think about what the research ecosystem looks like. And that helps them to really understand what their role is as an individual. And some people might say that when research misconduct occurs or that questionable research practices are observed, it could be that we have a bad apple. But it could also be that we have a bad barrel. And so where we really need to start thinking about our research ecosystem is how do we create a really healthy, robust, and supportive research ecosystem. So I use the ecological model to frame who are all the different stakeholders. We have the individual lab members, we have laboratories, we have schools and departments, we have our professional societies, and we have our funders and journals and public policy. So all of these different layers of this ecosystem work together. And as we move forward with this Research Ethics Program 2.0, I'm going to be thinking about how we might be able to create just different types of educational interventions that we can deploy across campus to really move toward a supportive and successful research ecosystem. So what might we as a campus do to elevate the ethical, legal, and social implications associated with research? So we really want to start thinking about how do we increase this. LC is the acronym for ethical, legal, and social implications. How do we increase LC literacy across campus? I think one of the things that's really important is that we not think about ethics as outsourcing to compliance or to various committees that help us maintain compliance in research. We really need to be taking a lot more ownership, especially because our research environment is changing quickly with the increase in socio-technical systems, artificial intelligence, machine learning, wearable sensors. And that's an area that I spend a lot of my time doing research on to figure out how do we do this kind of work ethically and responsibly. So we'll be reaching out to people on campus. We'd love to have you be involved. So please start thinking about how you'd like to be involved. And with that, I'd like to turn it back over to SAVC Continetti.
All right, thank you, Dr. Nebeker, and thank you to all of our presenters today. Now it is time to turn to the question and answer segment of this town hall. At this time, I would like to invite all of our panelists to go ahead and turn on their videos. And I'd just like to review the format. During registration, you, the attendees, have had an opportunity to submit questions for the panelists to answer. We selected some of the most popular questions for the panel today. If you have a question now, please use the Q&A window to submit additional questions. And I know people have been doing that during the webinar. And our panelists will do their best to provide answers. Due to the time limitations, of course, we may not be able to get to all the questions, but we will do our best to post the answers in the FAQ at return-to-learn.ucsd.edu. So I'd like to start with the first question, and that's for Dr. Sosha. With recent loosening of masking restrictions by the state of California, do we anticipate similar changes on campus in the near term? When might we eliminate masking requirements in classrooms and indoor sporting activities?
So they're great questions. And I think it will not be in all, we go from a lot of masking to no masking. I think it will be certain settings and gradually. We'll be taking into account the density of those settings, the likelihood people are in close proximity for prolonged periods of time. So I think classrooms and close indoor athletic events may be some of the last to allow masks to drop. We may find ourselves being able to do what we did, if people remember, in the late fall. We were able to drop masks for sips of water, small amounts of eating, things like that, for meetings, etc. So I think it will be staged, and it's probably coming in the next few weeks. For now, the athletic events indoors are going to remain masked with no food or drink inside of arenas. But outdoors, we are going to let folks make some more personal decisions about masking on our baseball, softball fields, etc. It will be, we're going to make sure masks are available. We'll encourage people that are not vaccinated or medically vulnerable to take advantage of a mask in an outdoor space. It's that moving to more self-management and awareness of what your personal situation is, your current medical conditions, health, as well as your vaccination status. And then you'll have some responsibility for trying to protect yourself as much. So it moves to more of personal self-care rather than public health policy. So we are going to allow some masks, the masks to not be present in outdoor sporting events, but again, they will be available. So you'll be seeing more of this over the next few weeks. We're taking it very carefully and thoughtfully. I think classrooms are going to stay masked for a while. We know that there's close proximity. Some of our lectures halls have quite a few students in them. So I think they're going to stay masked for a bit longer.
Thank you, Dr. Sosha. The next question is—
If I could just follow up,
Please.
just to be absolutely clear, Dr. Sosha has given a preview of what is coming, but any changes will be formally announced by all campus notice, so you can read it in writing and know exactly what's what.
Yeah, thanks for reinforcing this. It's a very deliberative process. So that's why right now we're kind of status quo, but we also want to tell folks we're not locked into something that it's going to be like this for 6 months. We are going to continue to look at the data, look at the information, and we can safely provide more freedoms. That's when we introduce them. And thanks, Elizabeth, for reminding everybody, it's done in a very structured way with clarity, so people do know what the guidance is for today.
All right, thank you for those clarifications. The next question is to Dr. Schooley or Dr. Sosha, and that is, when will UC San Diego employees be eligible to receive a second booster shot? 5 months following their last booster or 6?
This is a rapidly changing area as well. Anyone who has an immunocompromising condition is eligible already and should have had one if you're 5 or 6 months out. By that, I mean transplant recipients, people on biological response modifiers. Your doctor can help you with that. There is a national debate about when booster 4 should come along and what it should be. I think what will ultimately happen is that a 4th booster will be recommended earlier for people who are over 60 or 65 and later for people who are younger. That's just my bet based on kind of the scuttlebutt the last week or so among people who talk about this. When one looks at antibody decline after vaccination, antibodies decline relatively rapidly, but protection from infection declines much more slowly because we also have a cellular immune response, which is not measured when people measure antibodies. And so what we basically have to do as a country is to look at both the immunological decay and also the case rate pickup to see when we begin to see people who have been vaccinated at a particular point in time in a particular risk group begin to be more likely to get infected again. And so far, although we've seen decreases in neutralizing antibody titers, the reinfection rate after the booster has been relatively low, which is why we haven't jumped on and said everybody should get boosted right away just because the neutralizing antibodies are declining. But people are watching that very closely, and my prediction is it will be before next fall, but perhaps sometime in the summer, but we'll have to watch carefully at the epidemiology.
All right, thank you for that clarification, Dr. Schooley. The next question goes to EBC Simmons and ABC Jensen. Is it possible that the campus may need to pivot to remote instruction again in the future? Should instructors have a contingency plan for remote instruction in place for the foreseeable future?
Well, as we've seen, this pandemic can throw us a curveball anytime. Usually we seem to have some advance warning of a few weeks as we see what's going on around the globe. And as you've seen from the data presented today and at other times by Dr. Schooley and others, we keep very close watch on the national and international situation so that we can give as much advance notice as possible of any shifts that we might need to make in campus operations. So is there a non-zero probability that we would have to shift to remote instruction at some time in the future? Of course. I can't tell you that there is zero probability. What I can tell you is at the moment, based on all the information at hand, we are planning for a predominantly in-person spring quarter. ABC Jensen told you the scheduling is currently 94% in-person classes. And as of now, that's what we are basing all of our plans on. Yes, of course, it's prudent to have in the back of one's mind, what would I do if the unexpected happened? Of course, that's always prudent. We certainly hope not to need such plans for spring quarter. Thanks.
All right, thank you for that clarification. Now we'll go to Dean Moore. Dean Moore, what is the current status of educational opportunities abroad programming? Will spring and summer programs abroad be offered this year?
Yes, thank you. Yes, so some summer programs such as our global seminar programs are scheduled to be offered. We currently have over 20 proposed global seminars, and this is the period in which these seminars are looking for enrollments. So please encourage your students to consider these opportunities. We usually find out which of these get enough enrollments to go forward sometime in March, usually early March. With respect to UC EAP, which is the system-wide study abroad program, yet we again have these programs going forward. The Office of the President has allowed UC EAP to not necessarily cancel these programs, and so they're looking at them on a case-by-case basis. And the most recent figures show that we have almost actually about twice as many students participating in UCEAP in spring and summer than we had anticipated. So I just got off a budget committee meeting where we had anticipated about 800 system-wide students participating, and it looks like there's going to be about 1,800 students participating. So it is going forward. There have been some cancellations. You could go to uceap.universitycalifornia.edu and find out which programs have been canceled. So some areas we have had to cancel programs, but for the most part, we are returning to study abroad. And I'm sure our students and our faculty will be very pleased to be able to do that.
Thank you. Yes, that is good news. The next question goes to Vice Chancellor Peek-Asa. Do we still require a research ramp-up plan to be submitted for new projects or new laboratories?
Yes, this is a very timely question because we are in the process of moving the decision to ramp down the ramp-up plans through the process. As you can imagine, there are many committees, many experts. So we want to make sure we vet not only the decision, but the wording before anything comes out. But I think my advice is hold off for just a little bit before submitting a new or updating your plan, because we will be announcing very soon guidance on that issue. But we just don't want to be premature to making sure everyone who has expertise and input on how the decision gets plenty of time to weigh in on it. But in the meantime, we still very strongly encourage all of the best practices and safety standards in the labs. It is still required that all the general campus guidance is followed. And I think we have worked really hard to recognize the balance between safety and the importance of our campus for continuing research, and have really been happy and encouraged a lot of, sort of case by case, but flexible thinking in this area, in that, if you have something like an animal lab where you need to do a necropsy, you can add extra safety equipment to make it safer for more people to be together. So there's a lot of menu items that you can put together to come up with a safe plan. And so we are happy to work with you on that. Our website will remain up to offer best practice guidance. And I also just want to recognize Miroslav Kristic, Dr. Miroslav Kristic, and Faith Hawkins, who have, as many people on this panel, attended meeting after meeting after meeting, discussing being careful about these strategies. And they have been in touch throughout campus, making sure we have a very engaged process in how we can balance safety with research progression. And I don't know, Miroslav or Faith, if you'd like to add anything.
Actually, Vice Chancellor Peek-Asa, thank you for that, but also I have a follow-up question. What is the current guidance on research lab occupancy? Are we still encouraged to reduce lab occupancy, maintain social distancing, and promote shift work?
Yes, you're encouraged to maintain distancing, to wear masks inside, to follow all of the safety practices, especially recognizing that some of your lab partners may be at higher risk than others. But we also are recommending there be a lot of careful thought in how to balance the specific activities in a research team or a lab with how to maximize safety with those functions. I think maybe because Miroslav has been involved in these conversations since the research ramp up began, I'll maybe ask you to address parts of this question as well.
Thank you, Corey. I will just add that we have definitely terminated the strict requirements based on square footage and based on the number of people in an individual lab or per bench or an aisle or a bay. But we definitely encourage that the density be kept at as low levels as feasible in lab settings.
All right. Well, thank you for those research clarifications. Now I would like to go to EVC Simmons and ask, how will UC San Diego make decisions related to masking and remote teaching as the COVID-19 pandemic evolves to becoming endemic in our society?
We will keep monitoring the data and making decisions based on the best science that is available to us. Those are the principles that we have used throughout the pandemic, and we will keep using them going forward. And we will try to keep everybody informed as far in advance as possible, so that people can make appropriate plans for what they need to be doing.
Thank you. The next question goes to Dr. Sosha. Have CDC exposure guidelines been revised to account for the increased transmissibility of the new variants of COVID-19?
Yeah, I think you see that change to test on a notification in day 5 reflects the more rapid spread, more quick transmission of the Omicron variants. And so that's why we say, as soon as you know you've been exposed, grab a test because you may have converted, and then grab another one at day 5. By day 5, if your test is negative, you're probably going to be okay, but then the masking for the 10 days is just an extra layer of safety. So I think that is a reflection of a change. It used to be that we were the testing on day 10. We now think if you're going to convert, you're probably going to do it in the first few days. So we'll keep on top of that. Thanks.
Thank you, Dr. Sosha. And in fact, I have another question. This is reiterating some things you spoke about earlier, but could you please go over the current testing requirements for campus employees? Do you anticipate any changes to the availability of testing on site as we move toward an endemic approach to the virus?
Yeah, so the required testing, and this is the twice a week testing, that remains in place for winter and probably spring quarter. That, we don't see a change right now on that. That is for the unvaccinated and for the folks that are not up to date. So if you have an exemption and you're not vaccinated at all, or you're booster eligible and you're beyond your eligibility, so you're no longer fully vaccinated, then you need to test twice a week if you're involved on any activity on campus, even if periodically you're coming to campus. So that is the one requirement. We strongly encourage everybody whenever they have symptoms to get tested. We encourage folks, if you're in a building where there's a wastewater signal, please get tested as well. And then we just talked about the exposure testing. The vending machines will remain in place, including the 2 drive-up locations. We think that we'll probably continue that for the time being, foreseeable future. We did last summer drop some of the residential spaces when the residential buildings weren't occupied. So in the summer, when we are a little less present in terms of the residential spaces, there'll probably be a change. But I think spring's going to stay exactly the way it is. And the system works really well. People seem to take advantage of it. That's why we're seeing 1,000 to 2,000 people test every single day, which is great.
Thank you. Thank you, Dr. Sosha. Yeah, it's definitely one of the great success stories of our university's response to the pandemic. I think we've come to the last question, and it again goes to you, Dr. Sosha. Where can I get a free KN95 or N95 mask on campus?
Yeah, right now they're at the Price Center and at the Trove, so please take advantage of those masks. They're there for you. Some areas have actually acquired some in their workspaces, so they can do that through procurement. So depending on, if you're in a workspace, check out, there may be some available in your local workspace as well. But for everybody, there's access at the Price Center and at the Trove.
All right. Well, thank you. I think we're going to bring this webinar to a close. I want to thank everybody for their questions. We're going to do our best, as always, to answer everyone's questions by updating the FAQ that is on the Return to Learn website. And we'll also post a recording of this town hall. I'd like to thank our presenters today and guests for sharing their time and information with all of us. And I thank you, the faculty and researchers of UC San Diego, for attending, working together as a community to help bring us through these unprecedented times. Today, we had more than 320 attendees, and these town halls have really become an important part of how we stay united as a community. Hopefully, eventually, the need for them will diminish, but for the time being, it's great to see you all. To help improve them, and we encourage you to complete the post-event survey that you'll be sent shortly to help us continue to refine our communications during this challenging period. The next town hall for staff will be on Friday, February 25th. Future faculty research town halls are being planned for the spring quarter, and you can visit the RTL website to register. The link has just been inserted into the chat. So for today, this concludes the Return to Learn Faculty and Research Town Hall. Thank you, take care, stay safe, and I really look forward to seeing all of you on campus again very, very soon. Thank you.